All right, so we're up to 57 people now, so I'm glad we held off. We'll just give it a minute or two yet. It's only three after. Um, I'll just throw it out there while everyone, if you are new to joining this, we're going to have a little bit of roll call. Um, and then I know we'll actually have an opportunity for all of you to register as a new person. That way we can count your being here for part of our voting procedure. For those of you that may be joining new, keep in mind that please take a moment to read through the whole agenda and the last couple of pages of it. We do have some kind of rules of protocol we like to try to follow. It's not complete Robert's rules, but we really kind of want to make sure that, especially when we're doing these trainings or these meetings by video conference like this through Zoom, if you need to speak up, put your name in the queue or raise your hand or both. And we would like to keep it to one person at a time. Be respectful from each other. Get to your point. And if you start reiterating over and over your point, I might call and say, okay, let's see if anyone else has to say thank you very much. Not being rude, I just want to make sure that everyone understands that they all have that opportunity to speak. And what we really believe it should be this meeting as a open forum, open opportunity, non-intimidating, and make sure you feel free to speak up. But if you do feel that you can't really say anything in public, that's great. Do understand we want you to make sure your personal information is protected. And then we do have breakout rooms, and part of that breakout room is a great way where you can vent if you need to. We've got the three different breakouts rooms, one for stakeholders, basically advocates and participants, one separate one for the FMS agencies and IHSS. They talk about a little bit different stuff, and one other one, I'm not remembering exactly what it is, but feel free to choose the appropriate one for your group that you want to talk to. And only members and stakeholders are allowed in that members group. It basically allows you to speak openly and not feel like you're being intimidated by not saying anything. So with that said, I got the agenda up here. If you're calling in, you see right here, make sure you're doing the poll that is actually going to be posted a little bit here. Anyone calling in by phone, I think we still do a quick survey to say you're here. Cheryl Dorzette, I know you're here.
Thank you.
Anyone else that is calling by phone and is not logged in through the Zoom call, please say your name and we'll make sure you're counted. I don't hear one. Is Bobby here by chance? I didn't notice. Okay, she might be running behind. I know she's been working quite a bit lately. All right, so I think, Danny, are you going to publish that poll up, put it up there right now, or?
I was actually just about to ask Jessica if she's going to handle the poll
Jessica.
since McKenna's out.
Yeah, I've got it. Thanks everyone, and hi,
Sweet.
I'm Jessica Corral, the contract specialist for participant directed programs. I'll be filling in for McKenna today. So the first time attendee poll is what it sounds like. So if you have not joined this meeting before, it's your very first time, we definitely want to make sure we have you logged for attendance, as well as a little bit more information regarding like what stakeholder group you're a part of, and that directly connects to the voting rights if and when there are issues for you all to vote on. So I'm going to launch the poll now. You should be able to see it if you're logged in through Zoom by going to your menu and clicking on polls/quizzes. I know that the three numbers that are calling into the meeting I recognize, so no worries there for those individuals. We know who you are. I'll leave it open, and you guys can complete it at your convenience. I'll close in about 5 to 10 minutes, so we can actually move on from here now, Kurt.
All right. Thank you very much, Jessica. So I'm going to So if we can go to the agenda real quick. One thing I do want to mention while I'm thinking about it is, like I said, we don't have a lot of things on the agenda. There were a couple requests through the chat last week. We didn't really get a chance to talk to them, quite truthfully. And I want to make sure that people understand that we do want to talk and get some input as far as what's going on and what you would like to talk about. Um, I'm just going to say right up front, unfortunately, some of the stakeholder attendance has been off for a little bit. We do tend to go through phases where everything seems to be running smoothly, and then all of a sudden some things pop up at the state or issues with the program, and the next day we have a lot of people participating. But I'm just going to say, spread the word. This is a great program. You are the stakeholders. We run this meeting, not the department, as John Barry has always said in the past. So it is our meeting to help guide and as a collaborative work with the Department of Healthcare Policy and Finance to influence and, if necessary, change policy. So as we got an open forum right now, so anyone who wants to speak up about pretty much anything, let's open that up, the floor up to anyone who wants to talk. Please raise your hand or say you're in the queue, and then we'll start dealing with some open questions.
This is Cheryl Dorset raising my hand.
Hey, thanks, Cheryl. And Chelsea, I see you have your hand raised. Anyone else I got going?
Renee.
Hey, Renee. Great. Well, let's do a stakeholder, then we'll do Chelsea. I know. Hey, Chelsea, good seeing you again, by the way. And then we'll go with Renee. Anyone else? All right, let's start with Cheryl.
This has been a question that has been brought up for a few years and has been set aside for various reasons, but I am wondering if the volunteer position for ARs are going to be considered to have some kind of reimbursement ever, because they're doing more work.
I know we've discussed this in the past, so I'm not going to try to solve it right now.
I would like to put it up topic with the state to discuss. Okay,
let's add that as a chat item, someone where we can talk about that as possibly an agenda point at the next meeting. And I'll just, before I jump into other people commenting on it, this has been brought up in the past. A clear reasoning has been to avoid any conflict of interest for the authorized rep, who also typically has authority to approve timesheets. So, Danny, I saw your hand raised up right away on that. Is that something you wanted to talk about right away?
Yeah, I just wanted to respond to the request in the sense of saying we have had this as a topic in the past, and we have talked about it pretty in depth in PDPPC, and the general consensus is that it's federally prohibited. The authorized representatives receive payment. That being said, I would have to check. It was probably a year ago, maybe a little longer. There was some discussion amongst like the stakeholder group where there was some talking about putting together a PDPPC recommendation at ways that authorized representatives could maybe not receive reimbursement, but ways that authorized representatives could be supported. And I do not believe that that made it all the way to HCPF, but I did just want to share that information so that you at least have a starting point. And I just wanted to share that we have discussed it at length. So we might just need to figure out exactly what would be helpful and productive to discuss in a meeting.
Right. Yeah, I think if we could add that as a potential agenda topic, at least the form.
I got it. I wrote it down.
Thank you. All right. So we have done it before. Nathan, I see if your hand raised. We got a lot of options on that we have brought up. I think we even, if I recall, talked about it maybe being more of a support broker type role or something like that. In any case, let's add, we got that on the agenda. All right. So Chelsea, you were next in line. If you're willing to speak up, I'm ready to listen. We're ready for you.
Yes. Hi, Curtis. Nice to see you.
Nice seeing
Um,
you.
Hi, everyone. My name is Chelsea. I'm the Client Engagement Specialist at Palco. So this announcement is for those who receive CDOS services and utilize Palco as their FMS. So I just want to share an important update about the EVV solution that we use here at Palco. So starting March 1st, we'll be switching over to our Palco EVV system. So that means that attendants will start clocking in and out using Palco EVV instead of Authenticare. So Authenticare will still be around until March 31st, but after that, it is going to go away for good. So starting March 1st, we encourage everyone to start using Palco EVV just to make sure that it's going smoothly before Authenticare is fully deactivated. So to help everyone get comfortable, we have been hosting live training webinars, and we will continue doing these until March 5th. So these training courses walk you through the new system, what's changing, what you need to do. So it really is just a great chance to get questions answered and feel confident before that switch. And then you can sign up for those sessions, and I'll post the training link here in the chat just for anyone. So with the new system, attendants will have two easy ways still to record time. So one option will be using a mobile device or a computer, which is simple to use, and it just walks you through that clocking in and out. And then the other option is IVR, so telephone reporting. So with that, attendants will call the Palco phone number and follow the voice prompt. So both options do meet EVV requirements, so attendants can choose what's easiest for them. We will also be offering offline reporting. So for someone who does not have internet, attendants will still be able to clock their time in. And then once there's connection again, those clock-ins will be automatically uploaded. And then for the employers of record, so nothing is going to change about the way you review and approve those timesheets. So you'll continue using the Connect portal just like you do now. And all the time the attendants enter, whether through the app or by phone, will show up in Connect. So if you need help or want to learn more, Palco has lots of resources available, including videos and user guides on the website. So palcofirst.com/Colorado. And if you ever need support, you can also contact our customer service team.
Awesome. Thank you, Chelsea. Anyone have any quick questions? We're not here to solve anything, but all you people who are using Palco, make sure you tell your employees.
I have a question. This is Cheryl.
Hey, Cheryl, go for it.
We have attendants that are EVV exempt here in my son's household. How does that apply towards EVV exemption and paper timesheets?
So if you're using paper timesheets, that will not change. You can continue to use those.
Thank you for clarifying that.
Awesome. All right. Thanks, Chelsea. Hey, great seeing you again. Renee Farmer, you are next. And everyone, I know we're running a little bit late, but we don't have a lot on the agenda, so I'd like to keep this open forum going unless anyone has any particular objections. So in the meantime, Renee, your turn.
Yeah, can somebody please tell me or where to go, who to call to get what information is needed for range of motion and exercises?
Anyone out there who can answer that real quick?
This is Cheryl. I can answer that.
Go for it, Cheryl.
Your primary care doctor or a physical therapist, anybody that's knowledgeable or interactive with that particular care can write you a prescription or a letter to address it.
I need to know what information needs to be included on that letter.
Well, according to your case management and reviews, they have to have specifics that then I'll give you an example. They give me specifics that are put on the care plan and the state has to approve and review. So then I take those, that language to the doctor, and then it's a team approach. So you have to get the specific language, the specific needs, and get them addressed on paper by a doctor, but case management is my starting point.
Case management. Okay. Okay. I'll start there. Thanks.
You're welcome.
All right. All right. Next, I see Jasmine. I believe you had raised your hand next.
For
What have
Teach
you got?
Danny with HICPA, can I just add on a little bit to Cheryl's
Sure.
feedback for Renee? I just want to, since we have it open, I just wanted to make sure that everybody has the information that they need. And Renee, just to add some clarification, when you're working with your case manager or your provider, the information that they need to include on that documentation is outlining what hands-on tasks are being completed. So if you're a caregiver or if you are the caregiver and you're performing range of motion tasks for the individual, or you're helping them like lift their arm or move their leg, things of that nature, that's what would need to be documented on that home exercise plan to get exercise approved through CDAS or IHSS. And so just the description of the tasks that are being completed, as well as the frequency and the length of time that it takes to complete the task, that can be completed by a licensed medical professional, such as primary care doctor, nurse practitioner. We have expanded it to allow that documentation to be provided by occupational therapist, physical therapist, or a registered nurse. So just wanted to add that little bit. Hopefully that helps get the information that you need.
Thank you, Daniel. Everything good there then, Renee? So I've been through it. It's actually not as hard as you think. So your doctor know what range of motion is needed. They can write basically a script for that, submit that to your case manager, and they can usually walk that through pretty easily. All right, next in line, we have, I believe, Jasmine and then Nicole.
Hi,
Jasmine?
I just have a question regarding IHSS. I just finished the annual training that we're required to do, and during that training, they said that the supervisory visits needed to be completed every 90 days in home by an RN. We had asked for the regulations stating that, and they sent something over, but it didn't say anything about the 90 days. So I'm just hoping to get clarification on that.
Is there anyone who can answer that? That is outside of my pay grade. Anyone have an answer on that?
Hey, Kurt,
Hey,
I could answer that.
thanks, Amanda.
Yeah, no problem. Hi, Jasmine. My name is Amanda Smith. I'm the policy advisor over here at the department, and I may have sent you that email actually, or just generally speaking about. So I'm trying to lower my hand at the same time as talking, which is proving to be difficult. But yes, happy to answer that for you. So regulations, there's two sets of regulations that we're referring to of that 90-day supervision. So IHSS agencies should be completing supervisory visits according to their licensure. So rather than looking at 8.7 thousand rules where IHSS lives, that requirement is in Chapter 26, which is part of Department of Public Health and Environment, or CDPHE. So we have our breakout rooms coming up shortly. I'm happy to send that rule deck over to you for review, but that is where you would be able to find that requirement.
Okay, yeah, that would be awesome. Thank you so much.
You're so welcome.
Awesome. And that's why we have these meetings, everyone. It's great information we can share. Not necessarily solving problems, but that was quick and easy. So thank you for that. And then Nicole, I see you are on here. Outstanding. Your turn to talk if you still have a question.
I do. Let's see. I don't know about the breakout meetings. I'm not sure how to join one of those, but my question is regarding the care plan caps. Can we discuss that?
Sure. I know there's some new changes on the soft quote unquote caps, as well as limits on hours and overtime. So is there anyone who wants to address that? Is Kathy here by chance or someone from Consumer Direct here? If they're not here, I can.
Sorry, I was trying to find the mute button, Curtis.
Okay, great. No worries, Kathy. Thank you.
Okay, so just to reiterate too, I have Teams dinging in the background, which is a little distracting, but We want to talk about the caps for each of the, is
Yeah,
that
I think we
correct?
want to expand there's the max, there's the caps, the maximums, soft cap,
Well,
elevated to yellow for supervisors, elevated to the
specifically, there's a 91-hour care plan cap.
91 hours.
Yep, per
Um,
week.
I looked at it in our training manual. There's specific caps maximum for each of the three main categories. Homemaker, personal care is a different cap in addition to that, and health maintenance has a significantly higher cap even over all of those. So there's three different caps, and combined, my understanding was 169 hours per week, I believe was the cap was set at. So that was my understanding of it. And Kathy, maybe you can expand about how that's arrived at with the new direct care services calculator.
And I'm trying to scroll through the slides to give you the exact number for the caps for each section, the homemaker, personal care, and HMA.
Right.
So I'll find that, but it's really easy with the new direct care services calculator, the way it's laid out, which you can access on our website if you want to look at it for yourself before you do that with a case manager. And so anything that gets highlighted in yellow means that it needs the case manager to write a justification why it is over the cap and have a supervisor sign at the bottom of the form. And then if any of the totals turn red, that exceeds what the supervisor can approve, and that needs to go through the HCPF exceptions process, which has already started doing some courtesy reviews. So I encourage you to use that, or ask your case manager to use that. They have to submit that. If you want to see and no changes will be made, just so you know what to anticipate and maybe different documentation you could get to help support your care plan.
Okay, so you're
Does that
stating
help?
that the exception process, what is that? Because I asked in the appeals meeting last week regarding the exception process and nobody knew anything about the caps. So does it not follow the appeals process? Is this different in a
This
different
is
exception
different from an
process?
appeals process. Yes.
Okay.
So the case managers have had training on where to submit that. And
Have they
Amanda,
really though?
that I attended it with them, so I know, but it is a lot for them right now to take in. Amanda, did you have
Okay.
more to add?
You, Kathy, I didn't want to interrupt you. But hi, just wanted to loop around just basically around caps generally,
Yes.
and touch a little bit on exceptions. However, the soft caps that we're discussing, just for the context for the whole group, so everyone knows what we're talking about. So our soft caps are part of our Medicaid sustainability initiatives that the department are running. And so I am going to drop a link into the chat. I apologize for those on the phone, that highlights some of the initiatives. And one of those exactly is that soft caps that are anticipated for our April 1st launch. However, I want to be careful about talking about these budget initiatives during this meeting. As many of us know, a lot of things are changing and have been changing. So I don't want to give any definitive language or guidance as far as right now. However, like Kathy was saying, the case managers had recently gone through quite a bit of training in the month of January, and are holding office hours beginning back in January, and we're continuing them. And we actually have one today to discuss more of these issues that are coming up. So Nicole, if you're having issues with a particular case, though, I would highly recommend also filling out an escalation form if you're not receiving any assistance from your direct case manager. So a couple of different links I'll put into the chat. One is to the Medicaid sustainability webpage, where it has the fact sheet regarding the soft caps. And then for the escalations form, if you're having an issue with your case, or you're finding that maybe your case manager isn't providing that information for you specifically around appeals or any of that kind of information as well. We want to make sure that you're getting the right answer. So I will drop those in the chat shortly, and then we'll be sure. I believe we may have sent this in mailing materials previously, and if not, I'm happy to add that to next month's mail out materials as well.
Thank you. I appreciate that information. I guess a huge concern is the knowledge base and the high turnover rate in case management. And if you guys are aware and getting that kind of feedback, and if there's any thing out there to resolve the case management issue, when you guys decided to streamline case management and you put it all into one company's hands and the train wreck that has created.
And I'll just share there is more than one. However, it depends what area you live in. And so I'm just going to throw out there right now that the state's going through kind of a crazy crisis right now because of Tabor and approving things. And basically what's happened is trying to maintain sustainability. And this has been a huge transition ongoing, basically in the fact that a lot of this legislation has to go through the Joint Budget Committee. Everything gets approved or not at joint budget, appropriations, and then signed. The problem is making that all happen during our current active legislation section and trying to maintain and getting back in budget, which means a lot of this initiatives are planned for April or whatever. But right now, nothing's technically official until the governor actually says, hey, we can do it. So that's kind of the long and short of it. I will share with you guys also one quick thing regarding the soft caps and the alerts. I went through my training, and basically when the case manager puts in the times that you've discussed, it automatically pops up if it's a yellow or red. They don't have any real discretion at that point. So those are numbers that they then have to take it to a supervisor, or the supervisor take to the Department of Healthcare Policy and Financing for approval. And then if that doesn't agree, that is where your grievance process, I believe, happens. So going from there, but a lot of stuff going on. Stay tuned for more changes and stay informed by staying with our meeting here. Thanks very much for your feedback on that. All right, Nicole, you've been patiently waiting up there, raising your hand. Anyone else? But Nicole, go for it. Welcome. Oh, Nicole, you just lowered your hand, so I see you're still muted. Anyone else have anything else? I don't see anything.
I'm sorry, that was still me, I guess. Well, I appreciate what you just said, Kurt, but it really didn't discuss the whole case management change that happened before the finance changes that are being proposed after the change in administration.
Kurt, this is Danny from HICPUF. I can jump in and respond to Nicole.
Go for it, Danny.
Nicole, just clarifying, are you a provider agency or a member?
I need a pickup. Yeah, I haven't been helped yet. I'm sorry,
Nicole, go ahead. Did I lose you, Nicole?
I'm not sure if there's more than one Nicole, so I don't know if somebody started talking and it wasn't me. I am a caregiver.
Okay, perfect. Great question. So I will just say, I think that if there's a specific case management agency that you're experiencing issues with, we really, really request getting that information through our grievance process so that we can explore it more in depth. As far as overarching concerns about case management redesign and concerns about the foundation of case management, that's not necessarily something that we can really get into in this specific meeting, as that's not something that this group really covers. Our focus in this group is very specific to the benefits. While we do hear your concerns and we can take information back and requests back to our case management partners, it's just not something that we can really get super in depth with today. But I will have Amanda put the grievance form in the chat box for you. And I would very, very strongly request and recommend that you submit a form so that we can triage your specific concerns and address your specific concerns with case management agency.
Thank you very much. I'm just going to add one more thing to that. I've had people call and forward that link as well to them. And then I do want to share that quite a while back, I think this is actually way back during COVID, we had the head of case management agencies. I think his name was Vincent at the time. I think I saw that Ryan is now in charge of that. Um, basically explained everything that goes on with case managers and what they have to do, the training that's involved in there. They're juggling a lot of different balls happening at the same time. And I know one of the things they did is they actually lowered from, I believe you used to have a master's degree just to even get a job on that. So I know they lowered that to something to the effect of or equal equivalent. So but there's a lot of moving parts in that whole process. So I don't know if down the road maybe that's a situation we could talk about, but I know that the state did put out and change RFPs in the name of lowering it. We had like 50 some agencies plus in the state a while back, and I think we're down to like 19 or 20 now, which does make it a lot more easy to manage. However, it's still a lot to handle with everything going on. So thanks, Nicole, for bringing everything up. I appreciate it. Well, folks, we're getting a bit behind, although, like I said, I think we're fine. So if there's nothing else out there, put your comments in the chat. Anything you want to have added to the agenda, or better yet, go to the PDPPC section on the web on the government website, and you can submit requests for agenda topics. I promised everyone that I would be at the next planning meeting. I've already made arrangements for that to actually happen. So enter them as soon as you can, or even today, and we'll make sure that we'll figure out if we can get it on the next month's agenda. So with that, I know we are kind of splitting up into groups, and Jessica, I think you're going to present that. Let us give our option to cite in the groups. If there's no more information, let's give that a shot.
Yeah, we need to make y'all need to make a decision though. So we're about 15, maybe 20 minutes behind, and there's still an open forum scheduled after breakout rooms. So do you guys want to go about 20 minutes with the breakout rooms and no open forum, or about 10 minutes for breakout rooms, 10-minute open forum?
All right, so overwhelming is let's go for the 20-minute breakout, and then we'll come back with a really quick report if anyone wants to do that, and then we will call it a day and give everyone a little time back today. Outstanding. Thanks, Jessica. All right, everyone. Hey, welcome back, everyone. It's been a great meeting. We've got a very hard cutoff at 2 o'clock with the Department of Healthcare Policy and Finance. It is 2 minutes to. Thank you, everyone, for joining today. It made it lively, what would seem like was going to be a pretty low-key meeting. Please add any comments into the chat here if you have anything. One last time, we do save that information, and Bobby goes through that to make sure everything gets addressed in the next planning meeting. So with that, thank you again, everyone. Sorry for the quick cutoff. Have a great day, and we'll talk to you all next month.